The ICU team treated my husband like he was a family member. The manner in which they worked together and their relationship to him as their patient was amazing. In observing the expression on their faces, you could see the connection they had with him, and I knew he was safe in their care. We were impressed not only by their clinical skills, but again, by the way they personally interacted to ensure the care of the patient was their number one priority. I really gained a whole new respect for nurses. Those ICU nurses, they were lifesavers. Everyone was so positive and upbeat. They made our whole family feel good. You definitely could rely on them for anything and everything. They constantly shared information on what was going on and kept us updated on my husband's status. Their concern included me and my well-being in addition to his. They would always be there to help reassure me. They exude confidence and manage each other up so well. The courtesy, consideration, and respect directed toward us showed that these staff members understood what people go through in these difficult situations. All their positive feelings brought a great karma into that patient room. It was just so important. You could tell that they worked together as a team, and their communication skills were outstanding. I am proud to give testimony on how the dedication to their career as critical care nurses here at St. Mary's is priceless. We will never forget you and what you did for us.
I was in a traumatic accident and left me unconscious with a broken back and severe bruising to my organs. When I woke up, I was in a hospital bed in the worst pain of my life on my way to emergency surgery. I've never been so scared or vulnerable in my life. I wasn't at St. Mary's, but I was blessed with an excellent surgeon. The care that I received there, however, over the next week was at best disappointing. Once I was stable, they transferred me to the St. Mary's Medical Center rehab unit. I was a fairly new employee to St. Mary's and no one knew who I was, but despite that, the care I received when I got here was amazing. They made me feel safe and comfortable. Everyone from the registration staff to the physical therapist, the dietary staff, the nurses, physicians, radiology techs, you name it. It didn't matter who I encountered or what time of day it was. Everyone made it their top priority to make sure that I was feeling comfortable and knew what was happening. I wasn't able to take care of myself, but I knew that they were going to take care of me. They constantly asked me about my pain levels. They did whatever it took to help me with my pain and discomfort, and they educated me every step of the way. I always knew what they were doing, what was going to happen next, and where I was in my progress. The atmosphere was clean, it was quiet, it was peaceful, just so conducive to healing. During my entire stay at St. Mary's Rehab Unit, I had lots of friends and relatives come to visit me, and they would comment about how impressed they were with the quality of the care and the friendliness of the staff. There's so many intricate details of the care that I witnessed here for myself and for others that made such a huge impact in my life and in my healing. I never realized how hard the job of a healthcare provider is, and what a special person it takes to be a healthcare provider. They make such a huge difference in the healing process. I'm really grateful that I was transferred to St. Mary and experienced that great level of care and what a difference it made. And the care didn't stop there. After my release, the care management team called me and followed up on my progress and told me what I needed to do next and made me feel like I was going to be okay. I owe so much of my healing to each and every one of the caregivers here at St. Mary's. They cared for me with genuine compassion and care. I'll never forget them. I call them my angels.
My story starts with my husband, who was a patient in a hospital in the Chicagoland area. I wasn't familiar with that hospital. Sometimes when I would go there, I would look lost, and I know the staff would stop me and ask me if I needed help. And I think that has made me much more aware of visitors here needing help, and I try to reach out to them as much as I possibly can. One thing that was familiar to me, and it was really a big help, was the whiteboard. And I do know that people think that, other nurses at whiteboard, it's just one more thing for them to do. But it really made a big difference to me and my husband and I both. It was more like a link to what was going on with him and myself. And the nurses did a really good job of keeping up that whiteboard. The physician sometimes wrote on it, and it was really important to me. I had a negative experience at this hospital. One of the nurses in the ICU was very upset with my husband's physician. I overheard her at the desk, and really she made no bones about her displeasure with the physician. And this had to do with his care. And I really didn't want to know the details about that. I didn't really want to know that she was upset. It was more behind the scenes stuff that really should stay behind the scenes. It made it seem like they didn't really have their act together. And we know some patients can be really difficult. But when you're in the room taking care of that patient, they need to be treated like they're number one. Later on, you may need to vent, you may need to go back in the break room and vent, but while you're taking care of that patient, they need to be first and foremost in your mind.
All three of my children were born here at St. Mary's Hospital, and the oldest has Down syndrome. It was the care here that she received that made me want to go into nursing. After my daughter was born, she spent a week in the nursery. The nurses here arranged for me to stay in a doctor's suite so I could be with her here at the hospital. The nurses were all amazing. Before I could even ask, they provided me with information about Down syndrome, everything I needed to know. I wasn't overwhelmed. They presented it to me at a pace I could handle. They let me see her whenever I wanted and answered all of my questions. They showed me so much caring and compassion. They went above and beyond for me. Nurses are so busy, and for them to take the time with me to share with me and even cry with me takes a special person. While this was going on, I realized this is what I want to do. I want to be able to help provide information, to teach and to share with other families the compassion they showed me. And so 2 years later, I started nursing school. Now I've graduated, and I've worked in pediatrics for the last 2 years, sometimes in labor and delivery. Once in a while, a baby is born with Down syndrome, and it's an amazing feeling to talk to the family because I can relate. I've been there. It truly does take a special person to be a nurse. The care that my daughter and I received here has made me who and what I am today.
My sister and I were in an automobile accident as teenagers, and it took the jaws of life to actually extract us from the car. And the ambulance had brought us here at St. Mary's, and we came in through the ER, and we actually had to go to emergency surgery that night. And then we actually went to ICU after that and transferred from each floor as we healed throughout the week. I feel that I have had my full patient experience here at St. Mary's. And I owe all my gratitude to the St. Mary's nurses and staff here for all the wonderful care that they had given my sister and I and my family. One of the things that was really concerning for me was that when I was trapped in that car, I felt that my sister had died. And I had not seen her once we got to once we were in the ambulance as separate. The whole time I was laying there in the ER, I thought she had passed away. And it was very hard for me to heal throughout that time thinking she had passed. So one of the things that the ICU nurses had picked up was that I kept repeatedly asking if she had passed away, and they made sure that our rooms were right next to each other. And during my testing, they would actually let me wave to her, and it was helping with my healing. They had relayed this communication to the other nurses on the other floors, and they made sure that we were always sharing a room here at St. Mary's. So whether I went to second floor, third floor, as I graduated each floor here at St. Mary's, we always shared rooms. So that was a nice personal touch that the nurses were very compassionate about. The other great care that they had showed my family and I was that, we had no medical experience when we first came here. My mother, none of my family. All the nurses had the same quality of care, and they were showing the same wound dressing changes on each floor, no matter where I went, discussing the same discharge stuff to get me home, the equipment I would be needing, instructing that not only to myself, because I was just a teenager, I was scared and I wasn't really absorbing any of it, but to my mother and my father. And so they actually taught them how to be great nurses at home. Because of that quality of care that the nurses had provided for my family and I truly believe that we healed much faster than what we should have from that accident. We had multiple fractures, multiple lacerations everywhere. So to me, thank you to all the nurses and for the great care that they had given with that. I became a nurse because of the nurses here. They changed my life. I would not be here if it wasn't for them. And every day that I put on my badge and walk through those doors, I wear it with great honor and pride, and I'm so grateful to be a St. Mary's nurse. Thank you.
I've had all kinds of surgeries and procedures over the years, over 20 if you add them all up. I'm a cancer survivor. I was diagnosed in 2008. I had 2 surgeries and 9 weeks of chemotherapy. All the care I received during all those health issues I've had, along with my mother and sister being nurses, that all has made me want to be a nurse. I never had any doubts. I knew I wanted to be a nurse. So I went to school and graduated, and here I am. With my history and family history of cancer, I knew oncology was the place for me. It's hard to understand the pain that I was in during chemo. Also being in all that pain and being afraid, now when I walk into a patient's room and having felt all that pain, I know what it's like to lay in that bed. I like having the experience and knowledge of knowing what my patients are going through. I take the time to talk with my patients on a daily basis to see what they're struggling with. Sometimes I will open up to them and tell them my story, and that even makes them smile. I try to relate to them so they feel more comfortable. Even if you have never gone through what I have, you can spend more time talking to your patients. It really does help them, and they appreciate it. I want to talk to them and see how they're feeling and connect to them on a personal level. I know personally that really makes a difference to a patient, seeing that we care as nurses. With my experiences, I can reach out to people and hopefully make them smile. I love coming to work and making people smile. It's my favorite thing to do.